So today we're talking about dengue fever. Dengue fever is a virus, is a viral infection. It's caused by a virus. It's a viral infection that is transmitted by the vector Aedes mosquito. It is prevalent in tropical and subtropical regions, and it varies from mild to severe infections. That's dengue fever. Then talk about the history. It's been known since the 18th century, but it's of concern due to urbanization and of course climate change because it's prevalent in tropical and subtropical regions. Mosquito is the primary vector that transmits this dengue fever. Now you'll not be like, okay, dengue fever, how do you know dengue fever? What are the symptoms, signs and symptoms? Upon infiltration, upon infection with the dengue virus, you have symptoms like headache. You can observe headache, fever, pain behind the eyes, mild bleeding, skin rash, and in severe cases you have severe bleeding when you call dengue hemorrhagic. Dengue hemorrhage. That is the dengue. When I'm talking about dengue, I'm talking about dengue, dengue fever. All right, that's the signs and the symptoms. Now, what is the diagnosis? How do you diagnose dengue fever? First, you can say laboratory test to identify the dengue antigen or the antibody, particularly immunoglobulin M and immunoglobulin G. Those are the prevalent ones. To identify them, and then you also be able to identify a reduction in. You see a reduction in the platelet count of the individual that is affected. Differential diagnosis, of course, unlike in malaria, also in typhoid fever. Here in dengue fever, you are going to see the reduction in that platelet counts and hemorrhage, fluid imbalance, that's electrolyte loss, plasma loss, because of the bleeding, and in severe cases where you see severe severe hemorrhage. Alright, that's the differential diagnosis. So next, what is the etiology? It's caused by dengue virus, like I said. There are about 4 serotypes. Dengue virus affects the vector mosquito, so mosquito can be affected by a virus. The mosquito transmits it upon a mosquito bite, introduces it into your bloodstream. Then the virus replicates, grows, multiplies, feasts over using the host mechanism. So it grows and multiplies in the host. Now, upon that, it now begins to cause all these symptoms. The immune response causes increased plasma permeability. You can see the blood losses. Then, of course, once there is inflammation in the body, and rise in the white blood cell, you will see things like fever, headache. Then you begin to see rashes, mild bleeding, and in severe cases, that severe hemorrhage. I keep on saying it. Severe hemorrhage. So that's the etiology. That's the pathophysiology. That's how it affects the individual. Upon introduction into the bloodstream, it multiplies. Then leads to varieties of symptoms. All right. The treatment. Just by looking at the symptoms. First, okay. As pharmacists, we first list out the symptoms, and then we treat accordingly. The headache, the fever, analgesics will handle that. But then fluid replacement therapy is used, because of the blood loss. In severe cases, like I said, dengue hemorrhagic fever occurs where there is severe blood loss. So we need fluid replacement, and you use analgesics to handle the other symptoms. But you will not use NSAIDs. Remember, non-steroidal anti-inflammatory drugs. They have the potency of causing more GI bleeding. Alright, so you not use NSAIDs, you use other analgesics, and then fluid replacement. Yes. And then you also monitor the patient, or rather, monitor to observe the patient for any other symptoms and treat accordingly. Then prognosis, of course, early detection, there's always decreased mortality and quick alleviation of symptoms upon early detection and diagnosis. So dengue fever is a virus. Immune system should be stimulated, of course, because immune is responsible for viral infections. They handle virus. and then it should easily be what's it called, identified once you see the decreased platelets, the increased white blood cells, and of course the hemorrhage, vascular permeability, and you treat accordingly by giving the replacement therapy, fluid replacement therapy, and treating the symptoms, analgesics for the headache, but don't use NSAIDs. That's all about dengue fever. Thank you very much.